Fantastic.
Okay, well, I think we'll get started. Hope everyone's enjoying everything so far. I've heard a lot of positive comments. Everyone seems to be enjoying everything. We've had some great sessions this morning. We're going to continue that on this afternoon. Thanks, Gwen. Well, we are pleased, the sponsoring organizations are pleased to work with the Hub on this, who has been our official media sponsor for this event, and they've been helping promote it. If those of you not familiar with the Hub, thehub.ca, I encourage you to check out. It's an online media site. They do some great work. And editor, is that the title, Sean?
That works.
Okay. We're happy Sean Speer came out from Ontario to join us for this, and we're very pleased to have him and for him to conduct our keynote interview with Gordon Campbell. So with that, I will turn it over to Sean.
Thanks a lot, Troy. If the group will permit me to exercise moderator prerogative for one moment and just make a couple of comments before kicking off the conversation with Gordon Campbell, who of course doesn't require an introduction to this group. My first comment rather, is that it shouldn't be lost on us what we're doing today. Many of you have been in and around the world of ideas, politics, and public policy for a long time, and have lamented the tendency of our think tanks and other movement organizations to collaborate and work together. And I think it speaks so well of the leadership of the Montreal Economic Institute, the Canadian Constitutional Foundation, and secondstreet.org, that they've come together on this important issue and have assembled today's session. It really is the best of our movement, and yet it doesn't happen as much as one might like or as one might want. And so I'd be remiss, I think, if I didn't start by recognizing these organizations and the work that they're doing, most importantly, together. My second observation is that I'm 42 now. I'm not old, but I'm not young. And I've been in and around the world of center-right ideas and conservative politics since my teenage years. I didn't have that transitory experience with Marxism or socialism or whatever. I've been a conservative since day one, and I would just say that if that teenager or 20-something knew that at 42 I'd be interviewing Gordon Campbell on stage, he would have thought that I had done something right over the past 20 years or so. Gordon Campbell is one of the most important center-right reformers in modern Canadian history, and as importantly in my mind, he is the most successful center-right reformer in Canada's big cities over the past several decades. I happen to think that one of the biggest challenges facing our movement, broadly defined, is our ability to build inroads in our major cities to make ourselves responsive to and applicable to urban voters. And there is no one in the country who's done that more successfully over the course of his career than Gordon Campbell. And so, as I say, if 20-year-old Sean Speer knew that 42-year-old Sean Speer was interviewing Gordon Campbell today, I assure you he'd be pretty excited. And so with that, why don't we get started?
No, keep going. Keep going.
Of course, the main topic for our session is drawing on Gordon's experience and serious thinking about healthcare reform. But Troy mentioned that I've come from central Canada, and us Central Canadians have a lot of questions about what's been going on here over the past several weeks. And so if you'll permit me, I have a question. I think one of the things that we're trying to make sense of, Gordon, is whether there was something inherently inevitable about what we've seen play out over the past several weeks, by which I mean, as our federal politics have polarized, was there a sense that the Free Enterprise Coalition that you helped build was becoming somewhat unsustainable?
I think there was a sense that we are facing a very serious election in British Columbia, and people should be under no illusions about that. We have experienced the NDP majority for a significant number of years. Everything is going in the wrong direction. And I think there was a sense we have one primary objective here, which is we cannot let the NDP win another election. And what is clearly true in British Columbia, at least, is if you don't unite the forces of the opposition, the NDP will win. And there was no better example of that than my political experience. So 1996, we run for office, and to be candid, everyone said, oh, this will be a slam dunk, Campbell's going to win. Campbell didn't win. And we didn't win not because we didn't get the most votes, we didn't get the most votes in the right places so we could form government. And at that time, BC Reform took about, I think it was about 10 to 12% of the vote. Wow. As long as we're splitting the vote, the NDP is going to win. They have a solid base. It hasn't moved. Just like, frankly, when we heard from the pollsters today, they said healthcare is the top three. Healthcare has not moved from the top three issues that we face provincially, in my experience, or my lifetime, right? So you don't win. By 1998-99, we united the opposition, and instead of coming second in the House with, I think it was 33 to the NDP's 36 or whatever the number was, we came first, and we won 77 out of 79 seats. That's because we united.
Wow.
It's not because we divided. And I think one of the challenges today is to unite around a common agenda and some common goals for the future of British Columbia, and it was inevitable that had to happen if, in fact, we were going to be successful in our primary objective, which is not allowing the NDP 4 more years to take over and take from our lives. And so I think it was inevitable in that sense of the word, for sure.
Well, thank you for scratching that itch that I've had, watching what's been playing out here over the past several weeks. As I said, I promised we'd turn to healthcare. Earlier today, Troy mentioned that this week, I think, marks the 20th anniversary of the Health Accord, which, of course, was supposed to fix Canadian healthcare for a generation.
Right.
You were there then.
Right.
Talk a bit about that experience, what you learned from it, and what it tells us about the role of the federal government in either enabling or impeding some of the reforms that we've talked about today.
All right. Well, so I'd start by saying this. 20 years ago was the second Premier's Conference we'd had with regard to health funding. It was effectively about health funding. And one of the challenges we have is it's not about funding all the time. What it's about is changing the system so that people can make choices. I don't know how many people here made the decision that the government, any government, was going to be able to decide how you could be cared for. When was that decision made by us as citizens? It wasn't. And so, one of the things that the provinces were looking at, my first Premier's Conference was actually very early on after I'd been elected. And the premiers came together, and we had a premiers meeting, and one of the premiers said, I don't know why the federal government always seems to beat us in this discussion about funding. And I said, well, do you think it's because there's one federal voice and there's 14 provincial and territorial voices, and they're all saying different things? So what united us then was funding. So we got extra funding from Prime Minister Chrétien and his government, and then we had the meeting with Paul Martin and his government, and we got extra funding. Extra funding was obviously important to a provincial government who was looking at costs of healthcare, but it's actually a real problem that we have today. Not just that we don't need the money, but we need to change the system significantly and dramatically if we're going to take care of patients and not take care of institutions, and not take care of, sort of what was. So I think when we went through that discussion, honestly, I was very pleased to get the extra funding. But one of the things that I felt was lucky for us was when we tried to make significant change when Prime Minister Harper was there, and he let us do it. There was no interference from them. If we wanted to try something, we could try it. The problem, though, is virtually every province would say, we need the dollars. Yes. And so constitutionally, it's set up, the feds have nothing to do with healthcare, particularly healthcare delivery constitutionally, except potentially for Indigenous people. And so it would be best if they just stayed out of it, and the tax room that they take from us, because you're the same tax fare that pays provincial dollars, as pays federal dollars, as pays municipal dollars, regional dollars, the same taxpayer. If they shared that down provincially and let provinces make their own choices and get out of the way. I think lots of the things that they've done have got in the way. They've got in the way of innovation. They've got in the way of taking care of patients. And I think that's not healthy. I just want to, because I don't want to miss this quote, sorry. This is Tommy Douglas, who everyone says, there's the founder of modern healthcare. He said this: I think there is value in having every family and every individual make some individual contribution. I think it has a psychological value. I think it keeps the public aware of cost and gives people a sense of personal responsibility. And that was actually what came out of the 60s, was this idea that individuals could contribute and the government would provide a platform that would allow them to make their individual choices. Unfortunately, our individual choices were generally taken away from us, even though we were investing a massive amount in healthcare across the country. And we have to restore those individual choices.
If I may just say in parentheses, one of the reasons I admire you, and I admire Kevin Falcon, incidentally, is that when confronted with, in a way, what you're talking about, your government walked the walk, which is to say, when the Harper government, of which I was a part, announced that it wouldn't be renewing the health accord, it would simply be confirming the transfer payments to the provinces and letting them determine how best to allocate those resources. Right. We had virtually every government in the country, provincial government that is, criticize us, including ostensibly conservative ones in Quebec, Saskatchewan, and elsewhere. And it was only you and Kevin Falcon who said, thank you for the certainty, thank you for the flexibility, and we'll go back now and define our reform agenda as opposed to having the federal government impose it on us through some type of top-down arrangement.
That's what we actually honestly believed as well. And Kevin was a very thoughtful, and to put it in the most straightforward terms, he was not afraid to make changes that actually improved the quality of care. Little things he did made a huge difference, because as a minister, he listened to people who were talking about results. And we had a number of cases where he made programmatic choices within the overall system that allowed us to show how that worked. And unfortunately, he had a secretariat that was helping him with that. Unfortunately, that was disbanded, and he was followed by a health minister who gave a directive to one of his staff groups of, don't take me any decisions that cause any fuss. There are no decisions that don't cause a fuss. Right?
If only we had a binder full of those.
Exactly. Yeah.
May I just ask, just to follow up, because I know this is a question that sort of permeates a lot of these types of conversations. Based on your experience, Gordon, is the Canada Health Act an impediment to reform, or is it your view that there's sufficient scope within the confines of the Canada Health Act to make the types of changes that would improve access and affordability of health care?
I think the Canada Health Act has become a barrier to improvement, and a barrier to innovation, a barrier to patient care, and a barrier to people's choices. So I think the Canada Health Act has not actually, it hasn't delivered on what it hoped for. I'm not casting aspersions on the people that tried to do it. I just think we have to look at the results. And the results we've had are not good. In fact, they're abysmal. So just think of this. How many of us think we want to have a healthcare system that over the last 4 or 5 years almost 60,000 people have died on wait lists. And we're misled by being told those are electives, elective processes. They are not elective to the people that are sick. And you know what? We've found out that they're evidently not required by the federal elected people who take advantage of private facilities. They're not required by the judges. The judges who made the decision that said what BC was doing was okay, all can take advantage of private sector healthcare. The judges that made the decision that they wouldn't even hear British Columbia's case all get private healthcare. All of them do. And it's not, you know, I remember being, I'm an old-fashioned kind of guy. I think we live in one country, it's called Canada. I think we should have equal rights across the country as Canadians.
Hear, hear.
We do not have the same rights in British Columbia or Alberta or Saskatchewan or Manitoba or any of the other 9 provinces that they have in Quebec. In Quebec, if you do not get care in the timely way, you can access private health care and the government will pay for it. Why don't we have that in British Columbia? Why would a Supreme Court saying to you as a British Columbian, you don't have that right, that's just too bad? I don't agree with that, and I think it's destructive to the country because it reminds us there are too many differences. We focused on the things that unite us and providing every Canadian with the choices they deserve, we'd have a much stronger, more resilient, more robust set of public services across the country, I think.
Hear, hear. Well said. I should just say, I have other questions I'd like to put to Gordon. We welcome questions from the audience. People have green cards in front of them. Staff here are pleased to pick them up from you and share them with me, and we give us a chance to open up the conversation. As people think about possible questions, one thing I wanted to ask you about, Gordon, is something we've not just talked about, we wrote about together. In February 2022, I had the distinct pleasure to co-author a paper on healthcare with Gordon Campbell. It was published by a research organization associated with the University of Toronto's Monk School of Global Affairs and Public Policy, and it was a huge period of learning and knowledge for me because I was able to draw on Gordon's experience and insights. And one of the things that you really insisted on as we worked on that paper was that any type of introduction of private delivery ought not to be limited to a small number of specialty services. That you were concerned that if that's how we thought about reform, it risked producing some inadvertent consequences.
Right.
That we ought to have a broader view about the introduction of private delivery. Do you want to talk about that and why you think it's important?
Yeah, I think it goes back to the fundamental question. The question is, who gets to make the choice about your health care? And you should, with your physician, you should get to make the choice. And so I think that should go across the board, candidly. I think it should go across the board. The challenge, one of the challenges we have on healthcare now, and I think in government generally now, is the changes that are required to make it sustainable in the long term are massive. They are not sort of little incremental changes in punctuation and paragraphs. They are big changes. And as I listened to the polling guys this morning, what struck me is, you ask people questions without them really knowing what the consequences are going to be. Because the consequence of those questions is, if you're not happy with this system, what changes will you accept? And that's one of the challenges, I think, for people in public life. If you don't stand up and say, I'm going to try and do this, and believe that, then you won't feel like you got permission to try and do it. So I do think that's a really critical part of of improving healthcare. And the first change is I want to give you back your choice. And I'll give you a quick example from when I was Premier. We had a strike at one point, and that obviously built up wait times. And the question afterwards, well, how are we going to deal with these wait times? And the response was, we will have those diagnostics, those surgeries take place in public or private facilities. It doesn't matter. Wherever they can provide the quality service, we're going to provide it. And there was a whole bunch of backlash from the union. You know what the public said? You're darn right we should get cared for as quickly as we can. That's what I would choose to do. If it's my hip or my knee, I choose to be taken care of as quickly as I can. And one of the things that I discovered, frankly, Sean, when we were doing our article was, if you look at it, we have not successfully met government recommended standards for years in Canada. Years. And at that point, it was COVID. So we were up to 50% of people not getting the care they needed on the wait lists, right? And what struck me was, well, that's a lot of people. And then what I realized, it was 33% before COVID started. That's still a lot of people. That's a system that's failing patients.
Yes.
It is failing. And what we have to do as Canadians is stop telling ourselves everything's great. And you know what? The healthcare system works like a charm if you don't need it. It also can work like a charm if you have something really, urgent that has to happen. But it's not that. I always used to say to people, if a football player, forget a football player. If a mill worker works and is hurt at work, he can access the private system to get care as quickly as possible. If a maid from the Four Seasons is at home playing with her son or daughter, they're playing soccer, and she wrecks her knee, she could wait way, way longer. In fact, she could wait up to 2, 3, well, probably not 3, but 2 years to get her knee taken care of. And guess what? She can't do her job if her knee isn't taken care of.
Yes.
And we say that's elective. The only thing we're electing to do is not to take care of people. We should actually reverse that and say our job is to take care of people, not to figure out how not to. And as they identified today, block funding is a huge challenge with regard to that. And we should just know it. And it goes back. It's a pretty simple change to say we're not doing it that way anymore. Doesn't mean people won't resist it. Doesn't mean people won't say what's wrong with it. And here's, sorry for so long, but here's the last thing to remember. There is nothing more powerful than the tyranny of the status quo. And the first response you get from people is, if you change anything, we're going to lose everything. And I think we have to get beyond that. And we have to think about this stuff in a way that gives us a chance to solve problems as opposed to watch as they build on us, frankly, year after year after year.
We'll come to solutions in a moment, in part because a lot of the questions are zeroing in around the small p politics of reform. Mm-hmm. But before we get there, I think people in the room will note that you've been drawing on a lot of data and evidence. Right. The paper we produced together spent a lot of time situating the failures of the status quo. And again, through that process, you really were a strong proponent of the case for transparency.
Absolutely.
For metrics and benchmarking and open solicitation of proposals as a basis to build and grow public support for a reform agenda. Why don't you talk about what in your political career has caused you to place such an emphasis on transparency as a kind of crucial precondition for reform?
Well, I think there's two things that I'd say about that. The first thing is this: if you don't know where you're going, it's really hard to get there. And I think too often we don't identify our objectives. So what if we identified our objectives in healthcare? So for example, how many of you, there's something goes wrong, you have an accident or something goes wrong, you're not feeling very well or whatever. How many of you want to go and meet with an administrator in the hospital? Is the administrator your first choice for who to meet? No, you want to meet a doctor or a nurse or someone who can actually provide you with recommendations for care and diagnostics about what you might be able to do, right? So why are we building up so much administration and we are short of doctors, we're short of nurses, we're short of the professionals to provide care to people? Why is that a decision we make? Now, someone will come back to us and they'll say, well, you get rid of all the administrators and it still won't make any difference, won't make a dent. There's a lot of things that make really tiny dents, but when you start doing them based on how you can, improve the system and advance the system, then you make real progress. And so the reason I actually think evidence is really a valuable thing. And so Second Street is using evidence. I'd recommend everyone look at their quick video that they've done. Really uses evidence and says, and partly I say to people, I can't tell you everything to do. I could make bunches of decisions and somehow not all of them aren't going to be right. But at least if I give you the information of what we can do and you identify what you'd like in the system, here's a rule to remember too. Our job as citizens is to tell government what the rules are. It's not simply to acquiesce to whatever they decide. We should tell them what to do. And when we do that, we think about that in healthcare or education or the environment or the economy, then we have a chance that they're going to actually reinforce our common goals and our common objectives. And it's amazing what we can do when we get real synergy by working together to a common goal. You don't get real synergy when you're working opposed to one another. And I think that's a real challenge that we face today. So, but without the information, without setting a goal of this is what we're going to do, this is where we're going to do, this is how we'll measure it. Oh, and one last thing I'd say, you have to decide before you start what you're trying to accomplish.
Yes.
Because too often, when you haven't measured it, you come back and you say, well, yeah, that didn't work, but this is this and that, there's excuses. Evidence is a really good way of undermining excuses.
We have received some questions from the room, and a lot of them zero in on the subject of politics. In the paper that we co-authored,
right,
we wrote, quote, "The public instinctively understands the inherent scarcity of a province's healthcare system and is prepared for new and different approaches," unquote. Is there a case that the public is actually ahead of the political class on this issue?
Yes, there is a case that the public is ahead of the political class, but we should not be, whatever the political class is, but we should not fool ourselves about that. We've spent more time talking about healthcare this morning than most people in British Columbia have spent thinking about it in the last quarter, right? You typically don't think about it unless you've got a problem. And so partly what we have to do is change our conversation, change their conversation, ask them what they want, talk about whether we're being successful in meeting that need. And don't accept there are no panaceas, I don't think, for this. I think you've got to take step by step by step, keep making choices, keep working towards expanding choices, expanding opportunities. And I can tell you, we have to understand this about Canada too. Forget Canada for a minute. British Columbia. British Columbia is not one province. It's a bunch of different places that are bound by a boundary called a province.
Yes.
Canada's the size of the European Union. There are 28 countries in the European Union. If a cow gets sick, a mad cow in Switzerland, a province the size of, a tenth of British Columbia has their livestock taken care of. If it happens in Calgary, it's the whole country. Right, so we just have to put ourselves in sort of the world that we live in, and I do think that it makes a big difference when you give people choices, opportunities, and when you're willing to. And this is the other thing, maybe they won't make all the right choices.
Yes.
But I don't know if you guys have noticed this, but sometimes government don't make the right choices on your behalf either. Right, so. Responsibility is a big part of, I think, this, but allowing that to happen is an even bigger part.
We have a thoughtful question from someone in the room who says that, well, he or she accepts that the Canada Health Act is an impediment to some changes. Yeah. The truth is that even within the statute, there are certain steps that could be taken by provincial governments that they themselves have banned, like, for instance, mixed and dual practices for healthcare workers. Those of you from Ontario will know that the Ford government, ostensibly a conservative government, has cracked down precisely on dual practices in the context of the post-COVID period. What do you think explains that? Why have we not seen at the provincial level provinces trying to take steps within their own jurisdiction to improve the system, at least on the margins?
I can't actually speak for everyone or what's taking place in Ontario, but I can speak for this. If they think there's going to be a penalty for taking a different step, a financial penalty for taking a different step or trying taking a different position, they're going to be resistant to that,
yes.
I think. So I think that's really important for us to understand, is why it becomes an impediment and sort of it's a hurdle that everyone has to overcome before they actually act. So I do think that's a significant thing. And but I also think that there are provinces that have, Saskatchewan tried some pretty unique stuff and they were taken to court over it. Yes. We tried some stuff and we were taken to court over it. We didn't take ourselves to court. The feds didn't take us to court. Someone else took us to court. Brian Day, who's here, who is, frankly, is someone we should all say thank you to all the time for having patience. Because he never forgot what his job is, right? I think doctors take the Hippocratic Oath, and the first words are pretty close to the first ones are "do no harm." Our system right now does harm, yes. And we have to overcome that. So to stand up and give his voice to all those patients across the country who were forgotten by governments is, I just think, exceptional. Too many of us are too quiet for too long and wonder why the world doesn't get better. It doesn't get better because we don't participate in it. We don't actively engage in it, and we don't demand change to meet our needs and our neighbors' needs.
I've worked in politics, and people who either have worked in politics or been adjacent to politics are probably familiar with the phrase a sword issue and a shield issue, in the sense that there are some issues that are offensive where we are on side with a broad swath of the Canadian public and our political opponents are on the opposite side. And then there's the defensive issues where the situation's inverted. If an enterprising politician, either nationally or provincially, was trying to transform healthcare from a shield issue into a sword issue, how might he or she think and talk about it?
I think you start by talking about the consequences of the system that's in place. Yes. And I want to underline this because both Troy said this earlier, but I think it's really important to remember this. It's the system, not the people in the system.
Yes.
As we tried to advocate change and we're moving through some of the changes in the healthcare system, I remember when I was doing a tour of a hospital, a nurse came up to me and said, "Premier Campbell, just keep doing what you're doing. You guys are on the right track," right? And I said, "Thanks, it'd be great if you could say that." And she said, "No, I can't say that," right? So it's something that's really important, I think, for us to remember, is there's a lot of people that are in thrall to the status quo, in the worst sense of the word thrall. It's not that they want to be, it's that they kind of feel like they have to be. So I think that's really an important thing for us to remember and encourage people who stand up. So politically, I think the way to make healthcare a sword, if you want, is to talk about what isn't happening. So in British Columbia, for example, when they said, well, we're not going to have private clinics in British Columbia. It's okay for Albertans to come to British Columbia and have a private clinic, or British Columbians go to Alberta and have a private clinic, or a government who said no private clinics in British Columbia is sending British Columbians who need cancer care south of the border to Washington where they're using private clinics.
Isn't that a definition of dogmatism?
I think it's not just dogmatism. I think it's hypocrisy, and I think there's a lot of bad definitions of that, right? But it is just, we have to think about this and think about what they're doing. And when you think about it, it makes no sense. Yes. Unless it's driven by an ideology and a dogma that refuses to see the world as it is. Yes. I can't think of what else it would be. I honestly can't. And the other thing is the NDP government first initiated private clinics for exactly the problem that they met in the 90s. And then we get into the 2000s and they used all the resources from us to stop us from getting options to have access to care in a timely manner that meets our needs. I just don't understand. Well, I don't understand it. I really don't.
It seems to me part of that effort involves helping people understand what the counterfactual looks like, painting that picture. And I think it's to the credit of Second Street, MEI, and the CCF that a lot of their work is aiming to do that. They're not just reaching elite audiences, they're not just reaching policymakers, but they really are trying to paint a picture of a different, better way with Canadians. And I would just say in parentheses, I spend a lot of time in New York City where my wife is a lawyer. On Friday night, our oldest boy was a bit sick, and we called the doctor, and the pediatrician called us back in about 10 minutes.
Right.
If I needed an MRI tomorrow, I bet I could get it.
Right.
And so maybe why don't you just reflect on the importance of helping people understand not just the inherent flaws and contradictions with the Canadian system, but what a different and better approach ultimately means for them and their families.
I think one of our speakers today said you have to look way beyond just south of the border. You have to look to Europe.
Yes.
I did that in 2006. We went to Europe. We went to Sweden. We went to France. We were in Italy. We went to the UK. I think there's other examples in the world of people with a universal and accessible healthcare system. And it really goes back to facts again, Sean, if I can just say that. But we have to talk to people in their language. Yes. If your child is sick, how do we care for them? Do you want to spend 8 hours in an emergency ward? If you live in the interior British Columbia today, or this last couple of weeks, emergency wards are closed. Yes. They're closed because there's not enough people to provide the care. But what happens when an emergency ward is closed in the middle of British Columbia, and you have to drive an extra 3 hours to get to, say, Kamloops, or 2 to 3 hours to get to Prince George, where their emergency wards are open, and then you're just at the front of the line.
Yes.
And you wait for another chunk of time. You become sort of like, sometimes you go to a meat market or someplace or a bakery, and you get to take a number. And they'll get to you when they get to you. It's not that people don't want to get to you. Yes. It's they are run off their feet because we don't think of how we can provide better for them. And again, we live with the consequences of generational decisions. There was a generational decision in the 90s that said, we're not going to train as many doctors.
Yes.
There was a generational decision in the 90s that said, we're not going to train as many nurses. Well, when that happens, we start to feel all the pressures of that now. And one of the things we have to do is be willing to seriously contribute to that, but also seriously recognize that when we bring private sector resources, private sector innovation, private sector care into the system, we add to the system. We make it more accessible. Our system is not universally accessible.
Yes.
We have literally thousands of people every year that leave the country because they can't get care. And guess who those people are? They're the people that can afford to leave the country and get their care.
Just on your point, Gordon, about the supply of medical professionals and the long-run consequences of past decisions. Mm-hmm. If I may make a plug for the Hub, which Troy was so kind to mention, we published an essay a couple of weeks ago by Fraser Institute Senior Fellow Livio De Matteo that sought to estimate the number of additional doctors we'd presently have had the growth rate of physicians continued unabated before this change in the 1990s, and it would be something approaching 20,000. Yeah. So the long-run consequences of those choices, as you say, are with us. You talked about people leaving Canada in search of care. Mm-hmm. Let me seize on that, but ask about it in a different light. I mentioned that my family and I are in New York City, and there's a bunch of inputs that go into a choice about where we might live. Income is a big one. Proximity to family is another. But I can say, quite honestly, that healthcare access is not an insignificant part of that consideration. Right. Before we got started, we were talking about our children. Right. As a father of young kids, the idea that I could be in the weight room that you're talking about with my 3-year-old, or my 1.5-year-old, or driving far distances to get them care is terrifying. Right. I think, and we should know that. We should recognize it in Canada. We should recognize that you get a different kind and quality of care in the middle of Vancouver or downtown Toronto than you do
frankly, even probably in a place that's still a city like Sudbury,
Yes.
or a place like Williams Lake, or 100 Mile House in British Columbia, or Estevan in Saskatchewan compared
Yes.
to Regina, right? So we should recognize that. And you know, this is a thing that I think is real. This is why am I optimistic? I'm not. I think it's possible, let's put it this way, that we can solve an awful lot of these problems if we just put on a different thinking hat. Just put on that hat in a different way. And there's a quote that I love, it's not quite on this, but it's what is it? It's the problems, what is it? The issues of the quiet past are the problems of the quiet past are inadequate for the stormy present.
Yes.
The occasions piled high with difficulty, we must rise to the occasion. We must think anew, which is what we're all doing here, but we must act anew. We should disenthrall ourselves, and then we will save our country, right? We should disenthrall ourselves, and then we might save healthcare. The healthcare that I got to take advantage of, that my children will not be able to, and certainly my grandchildren will not be able to.
Yes.
So I think there are things we can do if we just think about this in a different way, and think about the quality of life that people have, think about our ability to deliver, and frankly, try some new stuff. Why will we not let people take responsibility for their healthcare choices? We should. And we should open up the agenda for them to take advantage of their healthcare choices, as opposed to closing it down, which has happened in spades in British Columbia, but it also happens across the country, and we should recognize that. And if I can just say one thing, because I love this part where we went through and we heard about this is a challenge, and people like this and people like that with the polling group. And the final answer was, and where does it lie? It comes down to the politicians. Those politicians, eh? Well, I was a politician, and I wanted to be elected. I wanted to be a politician. Not because I liked the label. When I would encourage people to run for me, I would say to them, you know, when you run, if you get elected, whatever you think your status is right now, it's going to fall off the table. So I'd been a teacher, and that was pretty high. And then I worked a while in city government. That was okay, not quite as good as a teacher. And then I worked as a developer. A developer. And that was way lower than working in government. And then I ran for office and I was elected. Whew, right off the table, right? So what we have, this is the thing I want you to all remember. We can talk about this as much as we want. We can get new ideas if we want. But there's a reason this happens. People let it happen. You, as an elector, let it happen. We have a bunch of people here today who are hoping to run for office. How many of you will go up to them before the end of this meeting and say, by the way, if you won't change healthcare so it works for me, I'm not voting for you? I never had anyone tell me that. I had people tell me we needed to reduce regulation. I had people tell me we had to reduce taxes. But when we say to ourselves, the politicians do this, well, yeah, they do, but we don't give them any encouragement not to do it. We don't give them any encouragement to go forward and do the tough things. Because believe me, there is a huge wave of opposition to change. So I mentioned the tyranny of the status quo. There's also another thing that we have. It's called wishful thinking. Oh, well, this will take care of itself. And then it's called willful blindness. Forget the evidence. Forget that thousands of people died on wait lists. Forget that it's not me, but why isn't it you? Could be you. You could be the problem. You know, we have to recognize that, and we have to say, if we're going to have a publicly accessible healthcare system, we have to work to give everyone choices across the country. And the last thing I'll say to you is, there's nothing that rotted my socks more than hearing that we had free healthcare in Canada. It ain't free. In fact, there's an argument that we deliver it in the most expensive way possible. And that's why more money doesn't help if you don't change. If we don't change, and we can't be retributive. People disagree with us, that's fine. We're still going to try and work for change that's positive, that takes care of patients. and that recognizes, you know what most doctors want to do? They want to be doctors. They want to practice medicine. They want to be in the hospital taking care of patients. Same with nurses. They want to give care. They want to be given the chance to give care in a way that's safe and secure for patients. It's the interaction between doctors and patients and nurses and patients that make it such a can make it such a rewarding profession. If they're looking over their shoulder at administrators, it's a lot harder. And that's why right now they're run off their feet and they give the best care they possibly can, but the system gets in the way of delivering care to patients, which is what people, I think, really want at the end of the day.
If you'll permit me to get a bit tactical, we've talked over the years, Gordon, including a bit last night, about your theory of politics in a way. Mm-hmm. And the way they talk about it in academic or think tank circles is the tensions or trade-offs between Big Bang reform and incremental reform. How do you think about, from the point of view of a policymaker or an elected official, how do you think about the case for or against Big Bang reform versus incremental reform?
Well, this is something actually that I learned, to be candid about it. I realized as I went through my first experience as either a mayor or leader of the opposition that, you know, sometimes you can't get people to jump across a canyon. You have to get them to build the bridge step by step by step. So these institutions now are large enough that I believe we have to make major change. And I think one of the things that disappoints people, the public, the voters, is that politicians sometimes promise major change, but they get elected and then they don't give it. And believe me, we need major change. And I'd say this, we need major change in Canada, and we need major change in the province of British Columbia. And those major changes are significant. And one of them I've always believed is, I always believe in giving citizens their own choices. So I'm a big fan of cutting personal income tax. And I said that as I went through my my second election, the one that we won significantly. But we identified we were going to have a major personal income tax cut. And we were elected, and we were in the interim, and I went into the room, I asked the potential Minister of Finance and the Deputy Minister of Finance to come in. We were going to talk about how large the personal income tax cut was. First thing I heard from the deputy, not a good time for a personal income tax cut. First thing I said to the deputy, feels like a pretty good time to me. We just ran an election saying we were going to have a huge personal income, or a major personal income tax cut, so we'll be having a major personal income tax cut. What happened? First cabinet minister, 25% across the board personal income tax. Probably the smartest political move I ever made, but we did it and we delivered it, and more important than that, it worked the way we hoped it would. It encouraged investment, encouraged job creation, and it changed people's outlook about what was possible. So I think we have to be big, and so later, I look back. As I look back, I was premier for almost 10 years. I look back and I say to myself, we should have been bigger the second time. We didn't have to do more the first time. We said we're cutting the tax, we're balancing the budget. We did both of those things. Were they tough decisions? Yeah. And believe me, after the personal income tax cut, I was Mr. Popular, right? When we started making the decisions to balance the budget, not so much, right? So we watched as our popularity went down, but we ran to make those changes in BC's economy so we could do other things. Major investments in healthcare, major investments in public education. You can't do those without a strong economy. So I think we have to do bigger, and we have to constantly keep our eye on the ball and do as much as we possibly can. Bigger is better than little.
That's a good answer, Gordon. But it's also a good segue to a question from the audience.
Yeah.
It seems to me that one of the characteristics of something like a personal income tax cut of the magnitude that you're talking about is that the feedback loop is rather quick. You know, that is to say that the upsides of that in the economy started to manifest itself early, so people could experience the benefits of those policy choices. The question from the audience is there a horizon problem when it comes to healthcare reform, which is to say the short-term reforms and the political reaction that they prompt may not be matched in the short term, say in a 4-year cycle, with some of the benefits that derive from them. In other words, how do you solve for that possible horizon problem?
I think the first thing is you identify it as a problem, and you point out people, and that's my experience from people, frankly, they all want you to think long term until they're thinking about themselves. Right? So they all want you to think long term, and we should. But we should say, this is how we're going to measure our progress, and then really measure your progress. It goes back to looking at what are the results of what you've done. And even in healthcare, we would be able to see the results. For example, if you allowed for access to private care, if the public system can't deliver you the care you need in a medically appropriate manner, which we haven't been able to do since we identified the medically appropriate manner, but if we can't do that, then we should have private care. You know what will happen? Wait lists will start to shrink. We'll have more access to care. I think we should, for example, give people the opportunity to invest in long-term health insurance. You know, you can pay a little upfront so that you have more security when you're older, right? And I would encourage that for people, because there are people that are worried about what happens when they get older. They're worried about what happens when they need to use a caregiver or a care home or more pharmaceuticals. They're worried about that. We can actually make them part of the solution. We shouldn't think it's not a partnership. It can be a partnership that truly provides better services, and I believe you can see a significant benefit from those better services relatively quickly. Not next month, but certainly over a 4-year term and potentially over a 10-year term or a longer term. And if you keep reminding people of the goals and sort of measure your progress, you'll be amazed how much people will reinforce that, that you're doing the right thing. People they're not bad. They don't want to be punitive. They're not ideological. I used to love going into meetings and talking with people who really wanted to hear what we were trying to do, as opposed to the meetings where people want to tell you why you're wrong and you're really not very bright and why they actually do have the right answers. None of us have all the right answers. But if we engage in a conversation, put the measures in front of us, like you're saying, you can measure progress in healthcare, in education, in all those things.
It seems to me it comes back to our earlier conversation about the importance of transparency.
Yeah, for sure.
We don't have that much time left together, so if you'll permit me, I might shift the conversation slightly. I recognize a lot of people in the room. Many of us have been in these types of rooms many times over the years, and I've been struck, Gordon, by the degree of energy I'm encountering at a conference like this. The fact that we have this many people here on a Tuesday, is it Tuesday? Tuesday afternoon in Vancouver, similar gatherings in other parts of the country. There seems to be, after years of feeling like we were losing the battle of ideas, so to speak, a renewed self-confidence. In some ways, the economic and social conditions call out for the way we think about politics, the way we think about public policy. Maybe just have you reflect on this moment we find ourselves in, and a sense that we seem to be in something of what you might describe broadly as a conservative resurgence. Do you agree with that? And how do we, if you agree, how do we seize on that opportunity to make the type of changes, not just to healthcare, but other parts of Canada's public policy architecture that we need?
Well, I want to be respectful about conservative versus another label. I'm not a big fan of labels. I think there is a strong, strong mood across the country for change.
Yes.
And the change, people are never looking for bad change. They're looking for negative change. They're looking for positive change. So we have to make major changes economically, I think. We have to make, if you think of the services that you think government should provide, and they should provide them well, then you have to have in your mind some of the things government should do. Or here's another thing for us all to think of as citizens of Canada, with a massive deficit federally and a massive deficit provincially. What are the things they can't do, they shouldn't do, they're not good at? Why don't we define what government should be, right? And not what it is, what it should be. Should we be spending almost $2 billion a year subsidizing the media from government? Does anyone think that doesn't have an impact on the media, the observations we get, the sort of the stories that we get? Of course it does. Because people, I think this is not a news break, but there are, the people in government are probably trying to do the best they can with what they've got, kind of, right? So we have to recognize there's some great people. I can tell you this from my own experience. There's nothing I tried to do or was successful in doing as an elected official that I didn't do with the public sector helping me. But you have to be willing to say that's the goal. And so I think it's time for really significant change. I would, frankly, I'm one of the few probably people that I know of that would advocate significant change in the Constitution. Because the Constitution is...
You can't drop that with 5 minutes left. How much time do we have, Troy? We have to start over.
Stay tuned to the Hub. I think it really is important to think about that. Constitution is the rules we give government. We give government. Everyone should get that. We all sort of own that. It's what we say government should do that they should do. And they frankly should get out of the things that they shouldn't do. And they should certainly get out not just 3% or 5% out of the things that they're bad at. We should look at not doing it at all if they're bad at it.
Yes.
We can do that. We have to be sort of brave enough to step across that hurdle, because it is something, it's a generational change that we need. And we need a generational change in thinking. We need to think anew and act anew. And then we'll save our country. Then we'll save healthcare. Then we'll re-enliven education services. Then we'll think about what's best for me and my family and my community, and we have a chance of getting there. I once said to someone, tell me the things that the federal government does well. And they were silent for a long time. And then they said, I've got it. And I said, what's that? He said, passports. Right before the passport debacle, right? Or we heard today from someone talking about the government trying to make up its own program when it's already been done.
Yes.
And guess what? Government doesn't know how to do that.
Yes.
You know how we know? Just go and look at the ArriveCan debacle. They don't know how to do it. And we should recognize they're not ill-intended, I think, lots of times. But here's the thing. No system is perfect. The best system is the one that you're engaged in, that you're part of, that you say, this is what makes my life better. Government should free people up to do more, not restrict people from doing what they want.
Yeah, well said. Well said. Well, please. Let's wrap up where we started in a way. Your response to my question about what the heck is going on in British Columbia was fundamentally about coalition building. Why don't you talk a bit, Gordon, about the practice, the art of coalition building for the type of vision you just outlined, of course with respect to healthcare, but as I think you've persuasively argued today, we need to demonstrate the same level of ambition across a wide range of policy areas in order to restore economic growth, and as importantly, restore people's sense of confidence about our country and society.
I think that last part is really, really important. This is the first time in my life, which is a very short life. I think I'm about 30 years old. It's the first time in my life where I have had people come and say to me, I'm wondering what country I should move to. And that is really, really significant for us as Canadians. Canada used to be seen as a country where everyone could get to yes, and now that we're seen as a country where everyone says no. We're not. I know we're not. I know people are not. So the first thing I think is our whole system is built up around opposition, right? So if John says this, then Jane says the other thing, the opposite, right? I think we have to spend way more time looking at what we have in common, and we have to recognize in a country as large as Canada that there may be different answers to how we accomplish our goals in spite of our common values.
Yes.
And that's really a critical component of, I think, building this. So I think coalitions are really about starting by listening to people, by looking for areas of agreement. And when you've got an area of agreement about where you want to get to, now you can talk about how you're going to get there. You know, am I going to take a bus from Toronto or to Vancouver? Am I going to fly? Am I going to take the train? As long as I know I'm trying to get to Vancouver from Toronto, I have a whole series of choices in front of me. And if I provide people with those choices, they'll get better and better. So I think, number one, you have to look for more allies. And the way you get allies is to find out the people that will teach you the things that you need to know to find a common goal and a common objective. In the late half of the 90s, I went, and you know what? I never went and said, this is what we should do. I went and I asked communities all over the province, what do you think we should do? What is getting in your way from doing what you want to do? And one of the nicest things that was ever said to me was at an introduction. Jack Poole was the chair of the Vancouver 2010 Olympic bid and committee, and he introduced me at a dinner at one point. And it was probably about 2004 or 5. And Jack introduced me and he said to me, or he said to the crowd, not to me, Gordon Campbell gave us our swagger back. He gave us our sense of opportunity back, right? And I think we have to get Canada's swagger back. And the way you get Canada's swagger back is you give people their swagger back. You give people the opportunity to walk to where they want to go. And we live in one of the places in the world where that's possible.
Yes.
I didn't say it was easy. It's possible. And more important than that, it's worth it. It's worth it for our kids and our grandkids. It's worth it for our quality of life. It's worth it. And I think, frankly, future generations deserve that.
Yeah, what a powerful way to wrap up our conversation. I would just discourage people from... I would discourage people from taking the train from Toronto to Vancouver because the government runs it. I want to, just before I wrap up and thank Gordon for his comments, let me just again emphasize how important it is that we've seen these three organizations, Second Street, the Montreal Economic Institute, and the Canadian Constitutional Foundation come together on this project. It is a model for the type of intellectual collaboration that we need in order to arm elected officials and Canadians to advance and champion the type of changes that Gordon is talking about. I've been in and around think tanks for over a decade, and I think this is the most successful partnership I've seen to date, and I hope it's the beginnings of more intellectual partnerships and collaborations across our movement, because as I said, I think we are on the precipice of winning some important intellectual battles, and we're going to need all of our best people and all of our resources in order to do that. And I don't think it should be lost on people that these groups have come together, have set aside their egos and their competitive instincts and the kind of narcissism of small differences in order to do this work. I think we'll all be better for it. And as for Gordon, that was a master class. You're lucky I'm going to leave the constitutional question off the table for today, but we'll have to take that up again soon. Okay. Thank you so much, Gordon, on behalf of the audience, thanks so much for...
I just want to say one thing before I stop. Sean has not said this, but he should say this. You should all listen to the Hub. You should all get on the podcast and pay attention to it, because it covers a wide array of products, but it actually is an engaging public conversation that you'll learn from. I certainly do, and so I'd encourage you to do that, and I'd encourage you to get your friends to do it. The more we actually think about these things, the better off we're going to be. And the last thing I'll say is, I really appreciate what Second Street has done and what others have done, and I think it's great that you all have spent so much time here today.
Sure.
And all I can say to you is, I'm glad you're thinking about it. Now do the most important thing: act on it. Get out there, vote, be agents of change, and drive it forward. No one else is going to do it for us, so we have to try and do that. So thank you all very much for your attention.